Oh, welcome to the show. I am so glad you're here. And this show is the beginning of Nurses Month. And how many of you know or have even met a male nurse? Well, during this episode, you're not only going to meet and hear from Black male nurses, these are men who are movers and shakers and innovators in the nursing profession. And I'll tell you, and I always tell you, I am excited, and this is a special show. But I am telling you, you're going to want to stay because these two phenomenal men are making a difference in nursing, in the practice, and also in their community. So, as we always do, I'd like to start us with just a centering exercise to bring us into this very special space, into this very special conversation. And so we're going to do a little heart math. And if you've not been with me before, it's simple. You just have to follow along. And it's an invitation. And it's an invitation to use our breath and our hearts to bring us into this present moment, but also to relax us. And this is something that you can do on your own. And you can do it with your eyes open. You can do it standing up. And no one has to know that this is your tool. That you have a toolkit and you can bring this out to kind of relax you when you need to. But for this morning, I'm going to ask you to just take a nice deep breath. You may just be waking up, or you may be in the middle of your day, depending on what time zone you're in, what part of the world you're in. Just take a nice deep breath, the deepest that you've taken so far today. And so when we breathe in through our nose slowly and expand our lungs, and then breathe out through your mouth like you're blowing out a candle. Okay? So you can focus better if you lower your gaze or even close your eyes. So I'm going to invite you to do that now. And it's going to take about 60 seconds. So please lower your gaze or close your eyes and take a nice deep breath in through your nose, slowly, and then out through your mouth. And then the next breath, you're going to take in through your nose and imagine your heart that's in the left side of your chest is expanding when you breathe in. And then when you breathe out, it's contracting. Breathing out through your mouth and your heart's contracting. Again, take a deep breath in through your nose and that beautiful heart of yours is expanding. And then take a nice slow breath out and it's contracting. And with this last breath, you're going to take a nice deep breath in and then imagine this bright yellow light filling your heart. Okay? It's filling your heart. And then when you take your breath out, that light is filling the entire space where you're at, and it's just embracing you with this warmth and helping you to relax. So now that you know that your room is filled with this bright, warm, healing light, I'd like you to take one more breath in and breathe in that light. It's filling your whole body from your head to the tip of your fingers and your toes. And now breathe out anything that is not serving you well this morning. So as we end this practice, I'd like to remind you that there's nowhere else you need to be in this moment. There's nothing else you need to be doing, and you don't need to judge anything or prove anything. You just are invited to be in this space. When you're ready, you can gently open your eyes and join us during this episode that begins National Nursing Month. And I can't wait to bring in our two phenomenal male nurse guests. They're innovators and I'm bringing them in right now. Here is Carter, and here is Aaron. I want to welcome you to this episode of The Poetry of Healing. And I'm telling you, gentlemen, I am excited about where this is going to go. So welcome, welcome, welcome. And thank you for joining me on this Sunday morning. I know it's early, but I really appreciate you both. So I'm going to begin with you, Todd. If you could introduce yourself and just let our viewers know a little bit about you and anything you want to share. And then, Aaron, I'm going to ask you to pick it up. Okay.
Well, good morning, all the viewers, and a big thank you to Dr. Van for the invite this morning and walking us through that very needed heart map this morning. I just got done with a 2-mile run, so it's nice to let things come to the middle and get to this space. So like you said, my name is Carter Todd. I'm a nurse, currently a nurse manager, so away from the bedside, but still supporting our frontline nurses in the best way that I can. Very passionate about what we get to do as nurses, the lives that we get to touch, the impact that we can make on our communities. I kind of wear 2 hats within the nursing profession, the acute care, hospital setting, and nursing leadership, but then also our advocacy work, community work, via the Capital City Black Nurses Association, which I'm sure we'll touch on multiple times in the next hour or so. So thanks for having me.
You're very welcome. And please so viewers, these 2 gentlemen are impactors, but they're very humble. So please, Carter, please tell the viewers your association with Capital City Black Nurses Association.
All right. I'll stop being polite now. So yeah, so Capital City Black Nurses. So we've started back in about 2018. There was a mighty band of about 12 of us in the Sacramento region. Myself, when I was in nursing school and then coming out, working in healthcare, I was frustrated with the way some of our Black patients were being treated and, cared for in our clinical settings. And then B, from a professional development standpoint, I didn't really have a lot of mentors or folks in my professional space that I can lean on and glean mentorship from. So I was very fortunate. I joined the National Black Nurses as a direct member when I was in nursing school. National Black Nurses Association has been around since 1970s, founded by some historic women and men in nursing who really stood for the Black nurse's voice at the big tables, right? So not just the bedside, but in the boardrooms and the C-suites, and then at the government level, changing policy. So I was very fortunate. I got a call from the former president, Dr. Eric J. Williams, who I always make sure that I give a shout out to. He called me and said, we need a chapter in Sacramento. And we started Capital City Black Nurses then. Fast forward to now, I just confirmed with our current president, we have over 100 members, 18 lifetime members. We're bringing the National Black Nurses Annual Conference to Northern California, first time in 20 years. We're collaborating with our Stanford chapter and the Bay Area Black Nurses Association. So a lot of great work that we've been able to do, programming not just locally here in Sacramento, but throughout the state, throughout the country. And then really just meeting and learning from some great nurses who have been doing this for a long time, who have really mentored us and shown us a really path forward, and then helping usher in the new folks behind us. I know Aaron and I were kind of that early career phase. I wouldn't say mid-career yet because we're right at that 10 to 15 year mark, but really finishing up our education. Now we're at the point where we're turning around and bringing folks with us and saying, hey, we did it this way. Maybe you can do it this way too.
Okay. All right, Carter. So viewers, I'm going to let you know, Carter led the effort to start the Capital City Black Nurses Association chapter. Okay. Yeah. All right. Aaron?
Well, good morning, everyone. This beautiful Sunday morning. My name is Aaron King. I'm an assistant nurse manager and a second-year PhD student over at UC Davis. I've been a nurse for 12 years. Currently work in med-surg area as a assistant manager. But in addition to that, as Carter spoke about, I'm also with Capital City Black Nurses Association, I actually started a year after with the chapter. I joined the chapter a year after they were formed in 2018. So I came along in 2019. Quickly was put into an interim position as the secretary, currently serving as the historian. I It was just been amazing connecting with Carter, connecting with other leaders in the area, just to really focus out on the community. As he talked about Capital City Black Nurses and National Black Nurses Association, we kind of sit on 3 pillars within nursing to really do a lot of outreach in the community as far as education, bringing resources. On that second tier, it's really about uplifting our current nursing workforce. So Carter alluded to that and the need of mentorship. In addition to that, just direction, right? Overall direction. And also the third pillar would be really recruiting into the next generation of Black nurses, right? So we can't just be in the units, we can't just be in the hospitals, in the clinics saying, I wish there were more Black nurses. What exactly are we doing about that? So that comes out in the form of education and kind of leading people on the pathways to nursing. But in addition to that, leaving little nuggets in the form of scholarships and internships, all those things that really help us complete our journey. So it's a pleasure to be on today.
Well, viewers, see what you're seeing here are 2 phenomenal men joining forces to make an incredible impact, not only in nursing, but in the greater Sacramento area where they are, where they have residence. But right now, I'd like to roll back a bit, and I'd like each of you to tell us, how did nursing become an interest? How did you get into nursing? Why did you choose nursing? So, Aaron, I'd like to start with you.
Sure. I started off in high school. I was always interested in science. So I was the one that wanted to go out and I can't remember what we were doing, put in oil, like eggs and vinegar in my mom's porch and just trying to figure out, like, do different things, experiments, catching bugs. So once I got into high school, I got to actually be in science classes. And so I was in a chemistry class. I was really engaged. And my instructor or my teacher talked to me and was like, you should join this health academy. I think you should maybe pursue something in healthcare. That would be, the next level to take this interest and really, build off of that. So I joined the health academy. So this was at Encina High School here in Sacramento. So they had a business academy and a health academy. The health academy really focused on teaching us medical terminology and really introducing us to different careers in healthcare. And so, of course, as a male, you think right away, like, I'm going to be a doctor, go into healthcare. That's what I want to be, as a medical doctor. We had the opportunity to shadow different professions. So, I mean, we were with x-ray tech, lab techs, we were with nurses, we were with doctors, and just kind of walking around. And I remember the first couple of weeks shadowing, I was like, where are all the doctors? Because, we were with all different areas, right? I'm thinking in your mind, you think there's these doctors everywhere that just kind of hang out in the unit, and that's not reality. So all the cool jobs that I shadowed, I was like, this is a cool job. Like, what do you do? Oh, I'm a nurse. I'm a nurse. I'm a nurse. I was like, you know what? I want to be a nurse. Like, this is incredible. And so I actually came out of high school really with the goal of becoming a nurse. I was accepted into 2 different schools, Sac State and Humboldt State, but I couldn't really get the financial aid together. So I entered into community college. Long story short, I was accepted in a program up north in Shasta College. And so I started off as an associate's nurse in 2012. And so that's how I started my nursing journey.
So you went to a 2-year college to begin your nursing journey. And, viewers, there are so many ways to enter the profession of nursing. And so we're unique in that way. You can go to the rare hospital-based program. You can go to a community college, which is 2 years. You can go to a baccalaureate or a university and earn a baccalaureate degree, which is 4 years. Or there are many other ways. If you have a degree in another discipline, you can go to what's called an accelerated program, and within about a year, be eligible to sit for your nursing, sit for the nursing license. So there are many, many pathways to get into nursing. And Aaron just talked about him being mentored and coached and advised to check the profession out. And so there are many ways that we're brought to nursing. So Carter, let us hear your story. How did nursing become your love?
Yeah, I think for me, whenever I look back, two different scenarios. One, my great grandmother being in the hospital, visiting her and being very intrigued by what was happening in the hospital, not necessarily what was happening to her, but just the professionalism. I just remember the smells and how interested I was very early. And then I had two aunts who were nurses. And I really respected them, thought they had a good life. They were very happy, right? So I think that instilled in me early what nursing could be. In high school, I said the very prototypical, I want to be a paramedic. I want to be a firefighter, right? Because I think stereotypically that's more suits us. And I didn't know any men who were nurses. So I didn't even think really it was an option. And then out of high school, I didn't really have any exposure early on. My exposure was I knew I wanted to be a nurse, but I was playing sports in college. Once that kind of went by the wayside, I was always doing well in school because I was very fortunate. School comes easy to me. I know how to do school. So I was able to then focus in on the sciences, like Aaron said. Was fortunate that some of the hurdles and stumbles didn't knock me out all the way. I was able to keep running. And I followed my twin brother up here to Sacramento and continued my education at Sacramento State. And like you alluded to, Dr. Van, I did that accelerated path. So nursing is very challenging to get into nursing school. It's very competitive, as it should be. It's very serious what we're doing. So you don't want just anyone getting in. Specifically here in Northern California, where we have nursing ratios, where the pay scale is in our favor, you have people coming from all over the country or the world coming to compete for these nursing schools here. So for myself, I'm a B student, a couple A's, some B's. So I had to find another path, and I'm very and forever fortunate to Sam Merritt University for seeing me more than just a GPA and seeing me as a whole holistic applicant. And they got me into that program here in this campus. I was able to continue working my 36 hours a week, bartending at night. I was able to stay in my bachelor pad with my 3 roommates splitting rent and put myself through nursing school. So when I look back on it, it's something that I always wanted to do. And like you talked about, Aaron got that exposure in high school. My exposure was shadowing and picking up volunteer hours. And I think the reason why Aaron and I are successful is we didn't fall into nursing, right? I think a lot of times I run into people in the community like, oh, well, I'm going to do nursing. Okay, well, you can't just do it. You got to really be intentional with the path. So are you doing the volunteer hours? Do you know what it even looks like? Are you aware of the prerequisite classes? Are you aware of the rigor that it takes in those prerequisite classes? Not that you're just taking anatomy, but that you're crushing anatomy and that you're getting the A's, right? So me for getting in and volunteering, I had to see, can I handle the blood and guts? And I could. So then, okay, now I can keep going, right? So I've been very fortunate on my journey. It was hard. Like Aaron said, I've been through junior college, state school, universities, online schools. I'm a forever student, always learning. And I think all paths are great as long as you come out on the other side being a compassionate, caring, and highly skilled registered nurse.
Wow. So your combined stories tell about either being mentoring or advised, having a family member be ill in the hospital and going to experience that. And just this inner drive. And I'm so glad, Carter, you talked about the rigor training for the profession. So viewers, if you are just joining us, you're dropping into a phenomenal conversation with two incredible men who are leaders and movers and shakers in nursing. They've introduced themselves and then just completed talking about what brought them into nursing. So what I want to talk about now is nursing is seen as predominantly a female profession. So I'd like you to give us some numbers. And, we talked about this. The numbers are so small, but just give us a sense of the representation of men in nursing and then Black men in nursing.
Aaron, I'll start this out, and you can come through with the data. He's the PhD student, so he can be more articulate than myself. So historically, men have been underrepresented in the nursing profession. You can go back to when nursing schools and programs were associated with actual hospitals, and Aaron maybe can help flesh that out. But long story short is it was very specific. You needed to be a woman who was not married, not bearing children, and you were allowed to be a nurse, right? So men in nursing is a newer phenomenon. Just a second. Sorry. Yes, baby.
So you see, we have lives, we have children, we have spouses, we have pets. So, and it's all good because this is a family show. So, Aaron, would you pick it up and?
So I think if you look at the different pathways into healthcare, right, we see it's very gendered, right? Everyone wants to be either, if you're a male, usually it's normal for you to be a provider, right? Like the male in the household, how we view the male in the household for many years. And then if you are a female or a woman, you're going to go towards being a caregiver. So that's why it's very strange for us as men to be within nursing as caregivers. I think we just really break the mold of what you think of as a caregiver. But looking statistically at the numbers, I think we fell around 6.3 overall for Black and African American nurses across the country. And then within men, I think we're hovering around 11%. So if you actually intersect that, which I haven't found any numbers anywhere, but I would say that we're probably, what would you say, Carter?
I'd say roughly, if I was to take my own guesstimate, about 20,000 Black men who are nurses in the country, and that would be highly on the higher end. And when we talk about men in nursing in the clinical setting, we're very unit specific, right? So if you go into an emergency department, you're going to see a lot more men. If you go into an ICU, you're going to see a lot more men. Versus you go into a labor and delivery floor or a NICU, usually some of the larger units in the hospital, small, a couple. Usually we know the one or the two. For myself, I started in a pediatric ICU. We had upwards of, I want to think, 120 nurses there. There was 6 of us, 6 men. So I think we also congregate in areas that suit us. I think when we talk about the gender differences in nursing, I had an assumption when I started, right? Oh, I can do it. I didn't think of the physicality of nursing at all. I knew I had to be caring, compassionate, something that I was naturally gifted with. But I think my own bias of, well, women do it, I can do it too. My first week, I was sore, bending over, turning people, lifting patients. And I'm a big dude. I'm 6'2", about 220. So very quickly, I was got some humble pie about what it means to be working in a woman's profession.
Mm-hmm.
Yeah, wow. I think there's also some bias there also that you get from the patients of not being able to be gentle or cared for. I remember being in the units and, people needing help with something and, oh, please don't be rough on me. I think there is some bias that you also get from the patients who don't believe that you can be caring or gentle as a nurse when you're a male.
Mm-hmm. Well, Aaron, you opened this door about the biases that male nurses experience. So I wanted to talk about some of the challenges you had in nursing school. Any way along your journey. I am preparing for. Oh, okay. Well, you go with it, Carter. Go with it.
I am a very caring person. I wanted to be a dad my whole life. I have two beautiful children, been married. In nursing school, I was still single. I really was looking forward to L&D, right? Labor and delivery, getting the opportunity to see life come into this world. I knew it was going to be special, a miracle every time it happens. I had a very problematic rotation during labor and delivery. I got kicked out of a lot of rooms. That's fine. I have no problem with that. If I'm going to do anything to make the room or the milieu not comfortable, by all means, I don't want to be here. So that wasn't the issue. The issue was the way I was treated by the nurses during that rotation. Very belittled at some points. I was very fortunate. I got to be a part of 2 deliveries, and it was amazing. The best was a woman who was on her 4th baby, very holistic, had her leg on my shoulder. It was amazing, right? The same day I was on a 12-hour stretch. The next shift came in because they did 8s. I had built a rapport with a post-delivery mom. We were cool, hanging out, just authentic communication. That next nurse who came in did not like that. She just, from the minute she clocked in, she was not happy that I was there. And it felt as if she was not happy that I had built that rapport with patient. So I'll never forget, I was going in to give the ROGAM shot, for L&D. Go in, do my process, give an IM injection. Awesome, no issues. I leave the room. Immediately, that nurse stopped me and she berated me on my practice. She berated me and told me that I was unsafe, that I should be kicked out of school, and she made me sit at the nurse's station because of a practice that was outdated because I didn't aspirate the blood, which I kindly told her in nursing school. They said that we used to do that, but the evidence says that we do not aspirate blood before giving an IM injection. Therefore, that's how I've been trained. She belittled my school, my training, and it was very unsettling. And the rest of my rotation was very, I was over it. I didn't want to be a part of it anymore. So that was a little bit of the bias that I experienced as a man in nursing, as from the negative. But in all reality, my experience in nursing as a man, the bias has actually been in favor of us because we still do live in a paternalistic world, right? So I get to leave nursing. I'm still a man. And we know that that plays in favor in us in the way that our country is set up, the laws, the regulations, and just the overall structure that we still are in, right? So, like, for instance, my wife is a physician. She writes her name on the board, Dr. So-and-so. They still call her by her first name, even though she's trained for decades, right? Versus Aaron and I walk in the room, we're in there just bringing ice, right, with a water pitcher, and they call us doctor, right? We didn't have to. It's different. So when it comes to the biases, I just still do think that they play in our favor as men in nursing, and the challenges that we face, the story like I talked about in L&D. Yeah, it's hard, but is it really setting me back? I do not think so.
Well, thank you, Carter. It brings to mind, and I'm going to say this cautiously, but I'm going to say it, and that is, from my experience, I have seen men in nursing advance much quicker than female counterparts. And we have a new dean at our school. It's a male, the first male dean in the history of this 100+ year program. And the respect that I have seen him glean in such a short period of time is amazing, phenomenal. And it benefits our college, it benefits our College of Nursing. So thank you for sharing that story. Aaron, what would you like to add? What are some of the challenges that you face training?
I think since we started on labor and delivery, I think I'll go there too. And I had a very different experience. It started off a little shaky. And so hopefully if that nurse is watching, she'll remember. But I was paired with the nurse, and she sat me at the nurse's station. I'm going to go grab something out of my locker. She was gone. And, I made it there for about 20 minutes, and the nurses asked around, like, what's going on? And I'm like, oh, I'm with this nurse. they're like, oh, you better catch her. She's going to leave you. She doesn't really care for students as much. And I think it was more of just the nursing student. I caught up with her. We had a quick conversation in the nutrition room, just, trying to connect with her. Nothing like, hey, why did you leave me? But just trying to connect. The rest of that shift was fabulous. In 12 hours, I got to see 14 deliveries. I was, and I think her approach was like, let's enter the room. You're in scrubs. We don't really need to go into your student, and they're going to think you're supposed to be here, and you'll be here. Because she was like, I want everyone, if they hear you're a student, they're going to be more uncomfortable with the student part of it than you being a male. So let's just bring you in. And if they ask you to leave, they ask you to leave. But, this is a borderline emergency. A body is leaving their body, right? So like a baby is coming out. So they're just trying to get this going, right? And so I got to see 14 deliveries, I think 3 of which were C-sections, and I just ran around. And I mean, it was so amazing because she knew that it was going to be a busy day. And I remember her saying, oh, first rain, we're going to have a lot of deliveries today. And we just ran. So it was an amazing experience. On the other half, in my actually nursing program, I was one of 3 men in the whole program. I was the only Black student in the whole building. So there were not a lot of issues, I would say, in the form of microaggressions, so not really intentional, but there were comments that were made. Like I remember one specific moment where the professor, we were talking about hypertension, and she said, I bet if we took everyone's blood pressure in this room, Aaron would have the highest blood pressure. So as if I didn't already know that I was the only Black student in the building, now I'm very much aware, that they also see me very different, right? And so that was my own experience. I think as a male in nursing school, some of the challenges specific to being a male is just trying to find other students to connect with as far as for studying, because you don't want anyone to ever think that you're out late studying, what's going on. We all have spouses. And so being very aware of that, I don't know any of the women or what their spouses are like in the class. Mm-hmm. And so I had to just be very delicate on like where we met and how late we were out. And in addition to that, my wife wasn't in town, so she didn't live there. She was 2.5 hours away. So I had to be very intentional with introducing her to people in the class and having her be comfortable because, she doesn't even know any of these people. But outside of that, I think my school is great. I think at the associate's level, you mentioned many of the programs, but I think at the associate's level, you get a lot of hands-on experience there. And I would agree with you said about men being able to climb. There's definitely a privilege there that we have in this profession.
Carter and Aaron, you are crushing it. We need a part 2 to this. Okay. All right. So what I want to jump into now, and viewers, if you're just joining us, we're with Aaron King and Carter Todd, 2 phenomenal nurses, male nurses in the profession. And they've talked about their history, and we just completed a discussion about challenges they had training. So my next question to you is, I'm going to roll forward, and that is, you are doing phenomenal work, innovative work. That's why I called you Innovators, innovative work using the barbershop as a hub. So can you tell us a little bit about how that came to be and a couple of the programs that you are offering in that setting? Mm-hmm.
I'll start off and I'll let Aaron bring us home. Before we get any farther, I do want to say part of CCBNA, part of the barbershop, and we are men in nursing, but we wouldn't be here without our sister colleagues. So Cherie Kreiner was one of our foundational members. And when I remember talking about this barbershop program in my studies, she was all for it. And she's always been a champion for us and men's health, specifically Black men's health. So I just got to give her a shout out. She's our current Capital City Black Nurses president. Mm-hmm. So again, going back to that network and the connections, I'm back in nursing school, my graduate program at Betty Irene Moore School of Nursing at UC Davis, thinking about my thesis work. And I had heard about a barbershop health outreach through the NBNA network and our Bay Area Black nurses. President at the time, Greg Woods, he had done a little bit of work in a barbershop, which historically had been, blood pressures, blood sugars, maybe a little prostate education here locally. So I went forward and I tried to understand Black men's understanding and desire to potentially pursue nursing via the barbershop with my thesis work. That was back in 2018, 2019, was able to present at the national stage at NBNA National Conference. And that work was amazing to spark us in a direction of knowing that this is how we can connect with the people, right? We know that statistically men as a whole do not seek medical care as regularly or as consistently as our female counterparts. Black men specifically and communities of color. We've heard all about the distrust of healthcare through COVID-19 and whatnot, and a lot of it is rightfully so. So we're better, and what evidence is there to get us to bridge the gap than a barbershop, where it's a hub of cultural influence, where we're having these authentic conversations. We're already talking about everything under the sun, whether it be politics, your health, your finances, your lady situation. And for me, being in barbershops, you hear people talk about things. And as a nurse, right, you can't take off your nursing badge. Someone will be talking about blood sugar. I'm like, that's not right. But then I don't ever try to correct anybody. Or they're talking about their sugar, their blood pressure. It's like, I just wanted to intervene and like correct them. But that's not what I'm there to do, right? I'm there to just rap and carry on. So that's where we started the barbershop, our outreach. Wow, it's been so long now to think about where it first started. We shot some videos. We did some programs. I'm going to let Aaron take it away because he has really been a battery in the back of this program and this work and building us out. So I'll let him take it on from here.
So, yeah, as Carter spoke about, kind of like a location to reach Black men since like the 70s. I think one of the first articles that I found was by Dr. Kong, and I can't remember the other individual, but both cardiologists that were doing work actually in faith-based interventions. And they noticed, they noticed that they were very successful in the church, but they weren't reaching a lot of men. So they actually shifted some of their resources into one of the local barbershops, and then trained a couple barbers at different locations to measure blood pressure. And they were very successful there. And it's kind of really spun off into barbershop interventions locally in communities across the nation. I've also found, a lot of studies outside of the country. But Dr. Relaford, I had the opportunity to work with him. He's actually a podiatrist that launched kind of like a national push that focused on hypertension and diabetes. And so it was called the Black Barbershop Health Outreach Program. And so he's published a couple articles, and what was innovative about what he did was he got grant funding to really put together, I guess you would call them care kits. So they were like big shipments, like boxes that were sent out with blood pressure monitor, glucose monitor, all the education needed, so it's like an intervention in a box. And you just open it up at your Black barbershop, you give the name, he printed out the flyers, everything. They were all included in this box. And so, one day there was a national push across the country at barbershops, across the nation, to look at diabetes and hypertension screening. And so I had the opportunity to lead the initiative in Reading. And so that was like my first introduction into Black barbershops. And Eddie was the gentleman that I worked with. He was like a community leader. Everyone knew him in Reading. We were in Reading, and I don't know if anyone knows anything about the demographics of Reading, but it's like 0.8% Black. So we all kind of knew each other. And Eddie was like the guy that knew everybody. I remember sitting in a restaurant, and it was like a little ice cream shop. And he came up to me and was like, "You're new here. Where are you from?" And I'm like, "Excuse me?" Right? Like, who says that when you're sitting in right? Like, how do you know I've never been here, And so we got to rap, and I'm glad that he actually pulled us in. He discovered this program and wanted to host it, brought me in as a nursing student. We worked with another local nurse to get this going. Very successful program. So after graduation and continue on school, when I connected with Carter here, I told him like, hey, I think we should do kind of like a barbershop program. He's like, yo, like that's what I want to do. And that's kind of like was, I don't want to say it was the center of his thesis work and master's, but he definitely recruited Black men through a barbershop for his study. And we got together, we were like plotting out a plan. We were going to like take it bigger, right? We didn't just want it to do like flash in the pan or take some blood. We wanted to make it bigger where we were drawing people in instead of just catching people where they are. And so we had plans to do a big health fair. We had a date. We were pulling permits, and then COVID happened. So then it was like, okay, so what are we gonna do? So we moped around for a little bit.
That's right. Yep.
Yeah, it was about 6 months where we were like in our feelings, all sad, right? Like Drake tears. And we were like, we got to do something else. And he's like, well, could we do something virtual? And I'm like, how would that even work? So we were just like rapping back and forth ideas. All of a sudden there became a DJ. Then all of a sudden we were like not at a barbershop, but we were going to be close to a barbershop, and let's invite guests and community leaders, and let's just make it conversations and really highlight the resources that we have in our community. And so we were at the Guild Theater, which is, very
40 acres.
Yeah, and very convenient, part of 20 acres in Oak Park, very conveniently connected to a barbershop. So you could literally go through a back door, down a hall, and you're in a barbershop. And so we were able to film in the theater. We invited lots of community leaders in, other organizations that really focus on Black men's health. My Brother's Keeper, Trap Medicine. I can't think of a couple other ones that we worked with. It was partly sponsored by UC Davis Health. And the innovative part of that was that we actually connected with our sister chapter in New York. And so they actually did some of the filming in New York, and they were inside of a barbershop having conversations. We would give them about 45 minutes. Then we would switch over to California, and we would have conversations and then switch back to New York. And so it was a really great program. And the cool part about that was it was streamed live on YouTube, LinkedIn, Facebook Live. And we worked with local barbershops in Sacramento to have it streamed onto their televisions inside their barbershops. And so it was conversations. So men that were waiting for their haircut kind of could see these videos, see what's playing, get a little bit of information about, we talked about manhood, fatherhood, sexual health, what else? COVID-19, of course, diabetes. We touched on a little bit of everything, and it just flowed naturally, the conversations. And, what resources do you offer and, with your program or with your organization? And it was great. And then we collected some survey data. And I think one of the biggest takeaways was it was all Black men, and how much of an impact that was on Black men that were watching. They were like, you just changed, the whole perception of what I see as healthcare, what I see as professional. We were showed up very comfortable in t-shirts and jeans, just as you would see me in a barbershop. And I think that is really what changed men's perspective of healthcare, sharing stories of our own, right? Like, I got an aunt that doesn't take her blood pressure. I got an uncle that doesn't go see a doctor, right? Like, I got cousins that smoke cigarettes and other things, right? And so just being able to share that and be authentic, like I'm a regular person, but when I'm in scrubs, like I'm here for you kind of thing. I'm not perfect is what was so great about that.
Wow. All I can say is wow, wow, wow. I didn't realize that it was live streamed across the country and most likely across the world, because the platforms you named are global. Oh, Carter and Aaron, there is so much that you have done and so much more work to do. So as we close, and I'm so hesitant, I don't want to close, but we have to close. So as we bring this conversation to a close, what advice, there are two questions I have for you. So what advice would you give men watching this program or men who know other men who might be interested in nursing, what advice would you give them as they pursue?
Advice I would be is go with folks. So it's hard being the only in any space, and it's hard doing it without knowing the path. Once I built a network, had Capital City Black nurses around me, everything has been exponentially easier. So reach out to folks, see who's been there. For instance, with our barbershop work now, fast forward, we've partnered with the Greater Urban League of Sacramento,
Mhm.
and our barbershop work with Cut to the Chase has been amplified by tenfold, right? So connecting with other men is very important. And I would say the last and the biggest takeaway is it's a cheat code. Nursing is that good. If you are nice, if you care about people, and you want to be an important person in your community, nursing is it. It's the ticket. And as a lot of and people like us, no one sees, oh, you're a nurse, oh, right, it's like, oh, you're a nurse, that's very nice, right, and that feels good. So regardless of pay, we get paid well as well, but it feels good to be a nurse. I'm proud to say that I do this. I'm proud to care for my family like this. And I think as men, as we stand up and want to take care of ourselves and take care of our community, that's really all you could ask for.
Mhm. Aaron Carter, thank you. Aaron, I'd like you to give advice to men who are currently in nursing, yet struggling or having challenges. What would you say to them?
I would definitely say really highlight the importance of what we consider third spaces, right? And so really finding a community, as he mentioned. And I think that being in nursing for, I believe it was 5 or 6 years before I came across Capital City Black Nurses, it was a space that I didn't know that I needed, right? Because when I come home, I could talk about the Black experience with my family, and they really understand that they don't really know nursing. And when I'm at work, I could talk to other nurses about nursing, but many of my colleagues don't know about the Black experience. And so coming to Capital City Black Nurses Association is really an area where I could have meet with others that are at that same intersection. And so it was just like supporting each other, right? Talking to each other. This is the problem that I had that was really difficult to me as a nurse. This was the problem that I had that was difficult, really difficult for me, as a Black man or as a Black person. And so it really opened up my eyes to so much, right? In addition to that, everybody is differently motivated to help you, right? Like everyone is helping you because they want to see you achieve, right? It wasn't until I worked for a Black manager that I was able to see that, right? For someone that is above you to say, I want to see you be my boss, right? Because that's just, I know that there's certain privileges that you have as a man, but I want to push you up higher, right? I want to lift you up. What can I do to help you grow, right? Instead of being in other areas where people become threatened by your growth, right? So definitely, I think finding community, and that community could be a professional nursing organization, that could be connecting with other nurses in your area, your unit, your hospital, your clinic, wherever you work. And then the other professional organizations that exist. And, there's the Hmong Nurses Association, the Filipino Nurses Association. There's Men in Nursing, which is a whole nother association. I had my opportunity to attend a first conference last year. Great space. Everyone's really pushing each other. And then there's critical care nurses. We have all these professional organizations. And no matter what the growth that you want to see, right? If you want to go higher in education or move higher in positions, these are definitely the networks that you should keep, right? These are the ones that are going to help support you and also be the shoulders to kind of lean on, right, when things get tough. So that would be my advice.
My last question to you, and all I can say is my heart is full. My spirit has been so uplifted. What do you do to heal? You don't have to say what it is, but this is a show about healing as well, healing self. And so I just like as we close, to leave the viewers with just one tip from each of you of how you heal anything in your life.
100% gratitude, even for the struggles, being grateful for having the ability to work through a struggle. When you get handed anything good, being grateful, handed anything bad, grateful. I think that single word in practice is worth its weight in gold.
Okay, thank you. And Aaron?
Um, I started going to therapy recently, and I really enjoying that. And as Carter spoke about earlier about our Cut to Chase initiative, focusing on Black men mental health, I got introduced into therapy by one of my colleagues, Dr. Troy Williams, and it's been really fulfilling, right? Because I feel for the longest time I'm pushing, 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 and if you would have asked me this a year ago, I would say probably like sleep, right? But to take an hour out of my time and dedicate it to myself and have someone on the other side of my screen, because I do virtual sessions, to really be pouring into me and to really focused, right, on me, right? I could be in that moment, just really centered and focused on my own. I think it has been amazing, right? I've been able to learn different skills, build on myself. And I always look forward to therapy and just having conversation and coming out with like little notes of things that I could do better, and really celebrating the accomplishments that I've had.
Gentlemen, Aaron King, Carter Todd, all I can say is thank you, thank you, thank you. This has been a phenomenal journey you've taken us on. And I want to bring you back because this isn't the end of your story. This is just the tip of the iceberg. And thank you again for your time. Thank you again for your wisdom. Thank you again for your transparency and vulnerability during the time we've been together. And I'm looking forward to hearing more. And you guys don't blow up. You're gonna be global. So don't forget us when you get there. Okay. All right. Have a good Sunday. And again, thank you.
Thank you.
Viewers, I hope that you have been inspired, enriched by the conversations from these two phenomenal male nurse innovators. That's what I call them. They're always on the edge, pushing the edge. And it's all about improving the practice of nursing, the care that they deliver. But they've gone beyond that, and they are enriching their communities. And because of the virtual access, enriching the world. Nursing is known for at least over 2 decades as the most respected profession out of all the professions. And so you may consider nursing as a profession. And if you are already in nursing, remember the tips that both Carter and Aaron shared. Connect with other nurses, connect with your professional organizations. And after the show, I'm going to drop down into the chat some, first of all, how you can connect with Carter and Aaron, and also a couple of links for resources of how to stay connected, at least to the Black Nurses Association. So in leaving, I usually either do affirmations or I read a poem. And I'm just thinking that I want to read, and I hope I can quickly find it. Oops. Sorry. You guys know I'm producing and directing the show and hosting and doing all the others. But I want to leave you with this because this is what's on my heart. And that is my poem from my book, Regala Healing. It's amazing. And and I'm going to modify it a little bit. So it's amazing to be filled with grace. It's amazing to have won the race. It's amazing the flow of my life. It's amazing I've lost the strife. It's amazing. So bright is my aura, radiating from my soul, letting me know I am amazing. And I want you to know that you are amazing. And Carter and Aaron are amazing. And all of us can be amazing. Until I see you next time, I'm here the first and third Sunday, right here, bringing you healing and poetry, meditation, and mindfulness. And I hope to see you again. And share the show, okay? I'm going to share with you a couple of items as we leave. Resources from me, okay? Thank you.